I'm Anna Yudin. I'm a doctor of clinical psychology and an author. Recently, I was reading this book called The Whole Brain Child. And it's a book about parenting. It was really interesting, and I wanted to bring some of the skills in the book to YouTube. But I thought, I don't think a lot of my audience are parents or would be interested in this topic. And so instead of addressing the skills in this book as pertaining to children specifically, I thought it would be interesting to apply some of these skills to how to interact with immature people in general. Because immature people, people who are psychologically regressed, they do, for the most part, act like children. Their brain isn't developmentally quite at the level that it's supposed to be. And so I think that a lot of the skills that we use on children could be beneficial for some of those adults as well. You know, if you act like a child, then maybe you'll get treated as a child. So this book is all about brain integration. Horizontal brain integration, meaning left hemisphere and right hemisphere, and vertical integration, or top-down. By the way, I'll put a link to my Amazon storefront in a pinned comment if you want to purchase this book from my own storefront. So when we talk about horizontal brain integration, what this means is integrating the left hemisphere of your brain with the right hemisphere of the brain. I'm generalizing here, but in general, the left brain is more related to things that are logical, literal, linguistic, linear, whereas the right hemisphere is more related to things that are holistic, nonverbal, bodily sensations, communication, feelings, instincts and intuition, the emotional. So an example of somebody that frequently overuses the left hemisphere of their brain would be somebody that is maybe very rigid and overly logical to the point where they completely disregard people's feelings on matters. You know, somebody that says, I need to do things this way, and if anybody interferes with the way that I do things this way, then that is unacceptable. Intellectualization is another example of overactive left hemisphere. Intellectualization is when, instead of addressing your feelings, you talk about like the facts of what happened, or you talk about intellectually what it means. You analyze it rather than truly sitting with your feelings. For example, intellectualizers in therapy will often be asked by their therapist, how do you feel right now? And they'll describe the situation instead of actually answering the question. Whereas people who overuse the right hemisphere of their brain maybe overemphasize their emotions at the cost of logic, not really considering the facts of the situation at all. Maybe are in a state or fight or flight following a trauma. So that's horizontal brain integration, integrating the left hemisphere and the right hemisphere. Now, vertical brain integration is integrating the top parts of the brain, which are higher order, the prefrontal cortex, for instance, parts of the brain that are in charge of executive decision-making, planning, empathy, morality, self-control. This is not generally fully developed until at least age 25, versus the lower parts of the brain like the limbic system, which deal with emotions, particularly fear, the brainstem, which deals with very basic functions like blinking and breathing. So obviously, if you have damage to this part of your brain, can be very, very dangerous because you literally can't do some of the things that are required in order to keep you alive. So not only is it important to integrate left hemisphere and right hemisphere, it's also important to integrate vertically. The more basic parts of your brain, the lizard parts of your brain, with the more high order parts of your brain. And the book makes the argument that one way of conceptualizing health is not just the absence of disease, but rather integration of the brain in all its different ways. So let's get into some of these skills for dealing with immature people with that in mind. Skill number 1 is connect and redirect. And this can be helpful when you're dealing with somebody who's being very emotional. So most people, when they're receiving like a temper tantrum from another person, tend to think about it logically and tend to give their evidence for why things are not the way that that person is accusing them they are. But if you're presenting logical arguments to somebody who is not using the higher order parts of their brain, or who is only using the right hemisphere of their brain, it's kind of like trying to talk to someone in a language they don't understand. You have to teach them that language before they can understand what you're trying to say to them. So the very first step is you have to connect with their emotional experience. I understand you feel sad because I told you I was going to come to your birthday party and I had a family emergency at the last minute. You're being comforting, you're being nurturing, you're connecting with their right hemisphere. And only once you do that can you move on to part 2, which is to redirect them to their left hemisphere. And this is where you logically explain your point of view. Now, like I said, some people, when they're dealing with immature individuals, either go straight into logic, circumventing the emotional experience, Or they forget to also introduce the logical piece, meaning they will validate the other person and never introduce reason into the mix and never sort of remind them of the facts of the situation, never sort of present their argument for why they disagree. That can also be harmful. You need to have both. You need to have both emotion and reason in order to have a well-rounded view of reality. Now, this skill, connect and redirect, doesn't mean that you never set boundaries. It is very compatible with boundaries. However, sometimes it can be more helpful to set the boundary after that person has calmed down, when they're no longer emotionally flooded, when they're able to reason with you. Because, in the context of children, if they're throwing a temper tantrum, they aren't capable of hearing the boundary. They aren't capable of even regulating themselves in the moment. It's the same with immature people. If they're not in the place where they can actually hear what you're saying or the boundary that you're setting, then it's just not going to get through to them. So address the emotional aspect first, and then redirect to your argument. And once they've calmed down, you can present what's acceptable or not acceptable behavior to you. Taking the example that I thought of, let's say you promised your friend you were going to go to her birthday party, but at the last minute, your grandpa ended up in the hospital, and so you had to go to that instead. And your friend comes back the next day really angry with you, throwing a temper tantrum, saying, I feel so unsupported by you, I feel like you weren't there for me, this was an important day. Obviously, in a situation like that, it would be really tempting to say, are you kidding me? Like, my grandpa's in the hospital. Why can't you also see my point of view? It's not always about you. Obviously, that would be very tempting. But if you were to deal with this person more effectively, a way to do that with connect and redirect would be to say, I hear you. It sounds like you felt a lot of grief about the fact that I wasn't there to celebrate your birthday with you. I get the impression that I let you down. And then see how they take it. And if they say, yeah, exactly, that's exactly how I feel, wait for them to calm down and then say, I understand that you feel this way. Unfortunately, there were extenuating circumstances and I couldn't come to your birthday party even though I would have liked to. And, I'm going through a really hard time now as well. And then maybe you can even throw a boundary in there. Like, hey, in the future, I'd really appreciate if you could also consider what I'm going through, not just what you're going through. Skill number 2, name it to tame it. This is a good skill to use after the immature person has just gone through a frightening or painful experience. Prompt them to tell the story of what happened using specific details. Because the left brain is dealing with the logic and the facts, putting it into words, while the right brain is dealing with the emotional aspects and wanting to be validated. So if you can do both at the same time, if you can have somebody tell a story about what happened, fill in the facts for them if they forget them, and also validate their emotions at the same time, it can help them make sense of the experience so much faster than if they were just, left to their own devices. That's why things like storytelling and psychodrama and art therapy can be so beneficial, because a person is basically telling a story through a medium, sometimes indirectly. Sometimes they don't even realize they're projecting onto that art form, but they're still processing what happened and integrating their emotions with the facts. Caveat though, do not push them to talk about it if they're not ready, because doing so can be re-traumatizing if they've gone through a traumatizing experience. So offer, hey, do you want to talk about what happened? But if they say no, respect that. And also note that it might be easier to have these conversations when you're not head on. I've heard from people before that when you have a conversation with somebody hiking or when you're doing something not face to face, it can be easier to be vulnerable. And I've also noticed this for myself as well, that I tend to disclose more intimate, vulnerable parts of myself with my husband, for instance, when we're, lying side by side rather than, facing each other, because that's a lot of pressure for anyone. So an example of how to use this skill would be, let's say your friend just had a huge blow up with her friend group and she's really upset for weeks on end and you're not sure how to support her. You can ask her, hey, do you want to talk about it? And she might say, okay, yeah, I do. Can you walk me through how it went from the beginning? And then as she's telling you the story, as you remember details that she's told you over the course of the past few weeks, filling those in and saying, oh, right, and Linda was the friend that said this to you, right? And then after that, Pamela said that. While you're doing this, while you're filling all these details in, really stopping and pausing at each scene and validating it. I didn't realize this until recently, but when I go through a difficult interpersonal experience, I naturally do this when journaling. I actually have a bunch of prompts in the personal growth journal that are inspired by what I've learned to do naturally in these situations, but I will literally map out chronologically every single thing that happened for multiple reasons, because firstly, I don't want people to gaslight me about what happened. I don't want them to say, oh, you just don't remember. It was so long ago. Secondly, because I think it helps me keep my brain from scrambling, because when there are a lot of difficult interactions, it's good to put them all on paper to feel like, okay, they're all here. I don't need to remember them all here and sort of rehash them. And, when you rehash memories, you are modifying them a little bit. And so to get it on paper right after the fact can be a lot more pure in its preservation of the memory. And also it just helps me process what I'm going through, because after I've gone through all these facts, I identify what were the things that happened that were triggering? What are the lessons that I learned from this that I'm taking moving forward? What were the other person's triggers? And yeah, it takes a long time. Usually after very difficult experience, it might take a couple hours to do this exercise, but it's the only way to really integrate it into your sense of self, because you gotta address what happened and you gotta address your feelings. And so the same thing is true if you're dealing with anybody, but particularly an emotionally immature adult. If they're struggling to make sense of an experience when they're feeling very flooded, it can help to sort of guide them through this. Skill number 3, model horizontal integration. So remember what I said, horizontal integration is about the left and right hemispheres. So how would you model horizontal integration? Well, through things like, you would show them that you can balance both rationality and emotionality. When you come home from work, stressed out about something that happened, you can talk about the facts of what happened while also honoring your feelings. And you can also hold your experience as well as the other person's experience. It doesn't have to be one or the other. Skill number 4, don't allow upstairs tantrums. So remember how I said that the upstairs part of the brain, that's the area of the brain that deals with higher order things like decision making, executive functioning. So when someone's throwing an upstairs tantrum, what that means is basically they are making a conscious decision to throw a tantrum in order to get something they want. They're able to control themselves. They can put on a brave face if somebody else walks in that moment, or if you tell them that they're going to face some consequences. The tantrum isn't coming from a place of genuinely being unable to control their emotional experience. It's coming from a place of, I'm choosing to throw a temper tantrum. Now, here's the thing. Unless there are extenuating circumstances like a traumatic brain injury, an intellectual disability, a very severe mental health diagnosis, everyone pretty much past the age of 25 has the capacity for emotional self-control. That's why abusers are making a decision to behave abusively, because they can stop if the police walks in 5 minutes. They can decide to not be abusive to their boss. No, they're making a decision to behave this way in ways that are not compatible with self-control with certain people in certain situations when they feel they're not going to receive consequences. Most people past the age of 25 have the ability for emotional self-control, and therefore most of the temper tantrums that adults have, that immature people have, are upstairs tantrums. They are that person making a conscious decision to throw a temper tantrum. And when you're dealing with an upstairs tantrum, the solution is not to validate or to enable. The solution in those cases is more to set boundaries and to explain the consequences of their behavior, to explain what's acceptable versus not acceptable. The authors of this book say, don't negotiate with terrorists. If someone's throwing an upstairs tantrum, don't negotiate with them. Don't do it. Here's an example. I understand you had a hard day at work. That does not make it okay to yell at me. If you're not able to speak to me respectfully, I'm going to cut this phone call short. Here's another one. You spoke to our waiter very rudely. There's no excuse to treat someone like that. If you choose not to apologize to him, I will have to apologize for you. It's level-headed, but it's not giving into the upstairs tantrum. It's not letting somebody's lack of emotional self-control dictate your life. It's setting a boundary. Now, skill number 5 is for downstairs tantrums. It's for people who don't have the capacity for emotional self-control, when someone is not able to engage with their upstairs brain. So, like I said, this can be the case in people who are under the age of 25, particularly teenagers. Teenagers have a lot going on neurologically. They don't really have the ability for self-control quite as well. People who have experienced recent acute trauma, if somebody's just gone through a horrible car accident, or, their life partner's just passed away, or, some sort of abuse has occurred, they're not capable of emotional self-control in that moment. Some sort of brain injury, like a traumatic brain injury, maybe even a concussion, a stroke in certain parts of the brain, a brain tumor, somebody who's intoxicated. Now, the thing is, Their self-control is minimized when they're intoxicated, but what they choose to do while they're intoxicated is absolutely still their responsibility. I am a firm believer in the expression that drunk words are sober thoughts. A lot of people disagree with me. That's fine. It's just what I think. The point I'm making is not that somebody needs to get a pass for throwing a temper tantrum if they're intoxicated, but rather understand that they might not have the same ability to emotionally self-control. Nevertheless, what they're choosing to do while they're intoxicated is absolutely their responsibility. And also if they're neurologically under 25 years old. So if this person has an intellectual disability that's severe enough, if this person has extreme regression, maybe because of acute trauma that's just occurred and they're suddenly, back to 4 years old in terms of their mental age. Your run-of-the-mill personality disorder, depression, anxiety, all this stuff, that would not count, okay? You don't get a pass for being emotionally unable to control yourself just because it's hard. It has to be physically impossible neurologically. So those are the situations in which you can use the skill, when you can tell that this person genuinely doesn't have the capacity to emotionally self-control. So the way that the skill works is you divert the temper tantrum and you try to engage the upstairs brain. And you can do this by asking, what do you feel right now? Why do you feel this way? And let's problem solve together, okay? So let's say that you're dealing with somebody who has a brain tumor, a part of the brain that makes them unable to emotionally self-regulate. So they come to you very upset, hysterically crying, can't be helped. So at that point you say, what's happening? What are you feeling right now? Where are you feeling it in your body? Tell me what's going on for you. Oh, well, I'm feeling really sad. I feel like pressure in my chest, okay? What do you think that's about? What sparked this? What's the last thing that happened before you started to feel this way? Well, my boss told me that if I'm not able to get this in by Friday, there are going to be consequences, and that really scares me. Okay, let's problem solve together. How can we make it so that you get this in by Friday? Skill number 6, not really a skill. This is a common expression in the world of neuropsychology. It's called use it or lose it. Use it or lose it refers to parts of the brain that the more often you use them, the more they light up when you're doing some sort of activity, the stronger they get. And if you don't use them, then they're not as strong, those muscles, anymore. Like, for instance, I used to take piano for a very long time, and I also haven't practiced in a very long time. And so I'm sure that I've lost some of those neurological pathways. Now, the thing is that even if somebody doesn't have an upstairs brain yet, let's say they're not 25 yet, or they do have some sort of neurological issue that prevents them from using their prefrontal cortex, they can still improve it. There are still things they can do to flex those muscles so that they get a little bit stronger, so that they improve a little bit. So the way that this works, let's say an immature person comes to you and they don't know how to solve a certain situation, some sort of problem that they're having, let's say like a relationship problem. Maybe they're actually a parent of yours and they're coming to you saying like, how do I solve this issue that I have with your mom? And you're like, okay, this is not my responsibility to swoop in and rescue you. You got to learn how to use this muscle to problem solve on your own. And so instead of saying, well, I think you should get mom roses, or well, I think you should do more of this and less of that, you say, well, what do you think about it? Like, what does mom like? What has she said that she needs from you? What do you think would make the situation better? What would you feel if you were in her situation? You're helping them flex the muscle of the upstairs brain, letting them practice sound decision-making on their own, and letting them figure it out at the end of the day. And also because, in the situation, it's most definitely not your responsibility to figure out your parents' problems. That is parentification. It's not right. So let them choose the decision and let them also live with the consequences of their decision. If they choose the wrong decision, they need to see how that's going to play out themselves. They need to see, okay, I need to troubleshoot this. I need to brainstorm a different outcome. Skill number 7 is encourage empathy. I talk about this in the connection course in relation to how you can take on more empathy yourself, but it's the same way that you would encourage empathy in another person, with open-ended questions that promote perspective taking. What might Jacqueline be feeling right now? Why do you think she feels that? What's giving you that impression? What would you feel if you were Jacqueline? And you can also encourage empathy by modeling empathy. So by treating people with compassion, by being gentle, by validating people in front of this person that you think could use a little bit more empathy. Because it's true that we are in large part who we surround ourselves with. And so if you model healthy empathy and perspective taking to this other person that's sort of struggling with it, they get to see a very concrete way of how to implement this skill. And it can also help to regularly switch the focus from them to other people. Like if they just said something kind of insensitive to somebody else and now they're crying about the consequences. Yeah, I understand this is hard. This is a tough situation for you. How do you think this person might be feeling? Or, something that's helpful during social anxiety, because it is so like me focused, and I say this as a person that has experienced social anxiety, it can be helpful to switch to other focused, meaning to go out into the world and instead of thinking, how do I come off as a certain way, thinking about how do I make the other person as comfortable as possible. And that's also an element of charisma in addition to loosening that anxiety. And skill number 8 is to encourage morality. When the top part of the brain is underdeveloped, that can sometimes result in a lack of empathy and therefore a lack of morality or even moral rigidity, like being very adamant that like, oh no, we never break the rules. The rules are always like this, without realizing that that's not really that moral. That's a very rudimentary sense of morality. Full moral development means people are able to live in the nuance and to have compassion for both sides to an extent. That's why it's called an ethical dilemma. There's no one correct thing to do. It's an ethical dilemma because you have to choose between multiple different choices, all of which have advantages and disadvantages. So a way to get people to understand this, the kind of struggle with developing morality, is to discuss these ethical dilemmas openly, hypothetically, frequently. If you look around in day-to-day life, you'll find that there are a lot of ethical dilemmas, a lot of moral nuances to discuss with people. If there's someone that you feel like could use a little bit of moral integration, talking about this, having these open discussions can be a really great way for them to practice and to strengthen those muscles. Modeling dialectics is also huge. If you're familiar with DBT or you've heard my videos on it, dialectics means living in the gray, honoring both the black part and the white part. I'm not speaking racially here, I'm speaking metaphorically. Like honoring, yes, you see things this way and I see things this way, and they can both coexist. We don't have to pick one or the other. We don't have to think so black and white. Something that helped me mature as a person before I reached age 25 was, I remember one time my husband, who was my boyfriend at the time, discussing an ethical dilemma with me. We were discussing something like sociopolitical. And I asked him, like, what do you think about this? And he said to me, I don't think I know enough about that. When I heard that, like I said, my brain was still developing. It kind of blew my mind because I was like, wait, that's an option, right? Like if you don't have all the information you need to make your opinion about something, it's okay to say that. You don't have to pick a side without having all the information. Similarly, when we're talking about a moral dilemma and somebody says, I'm not sure about that, that to me is a sign of, okay, this is a really emotionally mature person because they understand their limits. They're not talking out of their ass, and they have the humility to acknowledge that and to acknowledge that if they make a very rash evaluation without knowing the whole situation, that can be immoral in the sense that it can cause a lot of harm to people. And lastly, I think another way to model morality is to live in alignment with your values and to help the other person figure out what their values are. Having these open, frank discussions about like, hey, what's most important to you? How do you think you should treat people? And helping people see maybe ways in which they're not completely doing that. And same for you. Like I know for me, when I have kids, for instance, I never want to speak critically about other people's appearances or my own appearance in front of them, because doing that instills this value in them of superficiality and like criticizing them. It becomes like their inner critic. And so you can very much do the same thing with immature adults also. Being mindful of particularly being in alignment with your values around them, which is, I'm sure, the hardest time to ever do it. When somebody's triggering you, when they're being immature, it's the hardest time to stick to your guns, to stay mature, to have integrity. But it's also the most important time to do it. So I hope these skills were helpful. Do let me know what you thought of them if you have a favorite. And check out the Whole Brain Child, because there's a lot in here that I actually didn't address in this video. And if you ever want to become a parent or you want to just learn how to deal with people, be more psychologically informed, then I think this can be really helpful. All right, I will see you soon and take care.